Was your child just diagnosed with autism? Are they on a wait list? Are they doing therapy? Are you doing everything the doctors have offered but feel like there could be more? Do you want to know how to improve your child with autism's understanding and behavior without having to leave your house for another therapy session? If your child was just diagnosed with autism, I'm sure it's already been an overwhelming process, physically and mentally. They are most likely on a wait list or have started some speech and behavioral therapy that was suggested by your doctor. Is your child progressing as much as what you expected? Is their awareness and speech improving? Do you feel like you're still not getting all of the answers and treatment options available? Has anyone told you about nutritional treatment for autism? Recent research has linked autism to food sensitivities, digestive issues, environmental toxins, infections, and genetics. Have any of these issues been addressed in your appointments so far? Probably not. Does your child look lost in their own world? Do you feel like you're not able to connect with your own child because you can't get their attention? Some issues you might have already experienced. The overwhelm. You finally had your child assessed, or maybe you're still waiting for that appointment. Your life is now filled with speech and behavioral therapy sessions, doctor's appointments, meetings with teachers and EAs to figure out the best plans for your child. How about expensive treatments and so much time every day for these treatments? Your child's future is in the hands of therapists and teachers to do everything they can to support your child. Funding programs are changing frequently and services aren't always available for your child's needs. And early intervention is so important. All therapy and autism treatment is best when started early, as young children respond more quickly. If left for years, there is a decrease in progress and it takes longer for treatments to work. A young child with autism is easier to control, but as they get older and stronger, it becomes much more difficult. Studies show that we need to be looking at the medical side of autism. Looking at the inner workings of the body will give answers to what is happening on the outside that no behavioral therapy can address. Special diets, specific foods, and nutrients can support your child's health needs, allowing their brains to settle down and come out of their lost world. I have years of clinical experience in the treatment of children with autism, and now I'm able to offer the same program to families like you. Looking at the inner workings of the body will give answers to what is happening on the outside that no behavioral therapy can address. A few years ago, a new patient came in to see me at my clinic. We'll call him Jack. He was a little 5-year-old boy with big brown eyes. He was recently diagnosed with autism, and as much as I saw those gorgeous eyes when I met him, they never really connected with me. He was off in his own world and not noticing his surroundings or the people in it. His parents brought him in and proceeded to tell me his story, that when he was an infant, he would make eye contact with them and would say some words like dada and ball, words they haven't heard in 2 years. They found he became more and more withdrawn from their world daily and has now started having tantrums whenever they go out in public. These tantrums would last a few minutes, so they would try to alter their schedule so they weren't having to run errands while Jack was with them. Jack was first assessed and diagnosed with autism at 3 years old. Unfortunately, here in Ontario, Canada, the processing of children with autism isn't the fastest. Sometimes kids are on a wait list for essential services like speech and behavioral therapy for years. Fortunately for Jack, he was able to start his therapy sessions 9 months after his diagnosis. Not early enough, but at least he got in. His parents would take him almost daily to his sessions. They felt relieved that they were finally getting the support that they needed. Jack was progressing. He had learned to point at things that he wanted and retrieve things like his shoes when he was asked by his parents. As much as there was progress, his parents had a desire to do more. They wanted to help out too. There had to be more than driving their child from therapy to therapy session. But they were doing everything given to them by their developmental pediatrician. Nothing more was suggested, not even medications, as the doctor didn't feel it was necessary. Around 4 years old, Jack got a strep throat infection. Just like many kids do, he was treated for the infection, yet developed some symptoms such as diarrhea and skin rashes. His doctor told him it was probably from the antibiotics and would go away after a few days. He gave them a cream for the skin and sent them on their way. A few days later, Jack changed. Jack became very withdrawn from the world and fixated on necklace beads. They were the only thing that would calm him. His diarrhea turned to severe constipation and his behavior became more and more aggressive. Jack now would scream constantly and hit his head on anything around, the table, the wall, the ground, anything. His skin got worse. It now looked to be eczema all over his hands and back, and it was starting to crack and bleed. His parents took him back to the doctors with no answers. They all just said that it was autism, but the parents couldn't understand why did he change and why now. As it was, Jack's parents' lives were difficult with trying to juggle Jack's therapy schedule and their full-time jobs. But now things have gotten much worse. They couldn't take their son anywhere. Even therapy was becoming difficult and he was no longer making progress. His parents knew there had to be something more they could do, so they turned to the internet, as many do. They looked up natural treatments for autism and didn't find much besides a lot of websites suggesting a gluten-free and dairy-free diet. They were stuck. They were in a situation that wasn't getting any better and really couldn't get any worse. So they decided to try it. They weren't much for sticking to specific diets, but if this could help even a little bit, they knew it was worth their effort. Jack is somewhat of a picky eater, but they thought that if they were going to change their diet, that they would do it as a family. So they did. They embarked on a gluten-free and dairy-free journey as a family. After about 6 weeks, they saw some changes. Jack's behavior had improved, he had become less aggressive, and wasn't hitting his head off the floor every time they went out. He continued to scream frequently and would still have tantrums, but just less aggressive in nature. They knew they had unlocked something in their son. They had made progress, but didn't know where to go from here. Again, feeling helpless. Was there more they could do for their son to bring him out of his world and into theirs? And that was it. That is when I met Jack. His parents had done some more internet searching for people who specifically treated children with autism. They needed to dig deeper into natural treatment and dietary changes, as they have already seen some progress, but needed guidance about where to go from here. When I saw Jack, he didn't connect much with me. Like I said, he had beautiful big brown eyes, but wouldn't look directly at me for more than a few seconds. His skin was rough with eczema and his belly was sticking out and looked full and sore. No wonder this little guy was having tantrums and screaming. He was in pain. I chatted with the parents about his history and the journey they had been on. Jack had definitely had ups and downs, but it seems that he was on his road to recovery. They had made recent progress with dietary changes, but had plateaued, and so it was my turn to take it up a notch. And this is what I do. I pave the path for you to follow. I hold your hand in a journey of recovery. I guide you, but you still need to do the hard work. I worked with Jack and his parents for months, tweaking his diet, making changes based on his specific needs. He ate certain foods to give him the nutrients needed to support his body, as children with autism have differences in the biochemistry of their cells, the bacteria in the gut, and their ability to detoxify toxins. The last time I saw Jack was a few months ago. He strolled into my clinic, said hi, and gave a little wave. He knows exactly where to go, directly into my office to play with the magnet toys that stick to the door, a favorite of my patients. His parents updated me with his progress and current health. Jack can say more than 50 words. He's no longer having tantrums. There are no more bowel issues, and his skin is clear and soft. As I'm chatting with his parents, Jack approaches me and looks me in the eyes. Those big brown eyes are connecting with me. He has let me into his world and he is a part of mine. He puts a toy magnet in my hand to play with him. How can I resist? This is what we've been working towards. Most people are not familiar with this specific type of autism treatment because your medical doctors and therapists are not trained in nutrition. They do not understand the connection between food and our bodies, like the gut-brain connection studied by the National Institute of Health. As a naturopathic doctor for over 15 years, I have studied the intricacies of how foods and specific nutrients affect the bodies of children with autism specifically. Hundreds of patients have seen improvements in their children's health, attention, focus, speech, sleep, with the help of my Nutrition for Autism program. Imagine having a closer connection with your child, having them present in your world. Improved eye contact, more recognition of their name, improved sleep, less stimming and repetitive movements, less tantrums and more calm behavior, better transitions, decreased sensory issues, improved social interaction, faster progress in therapy sessions, improved immune and digestive health. Imagine visiting friends and going out to a restaurant without having to worry about tantrums. Imagine connecting more with your child and knowing that you're doing everything you can for their development. Do you want a healthy nutrition program specific for your child with autism to help decrease unwanted behaviors and increase their cognition and understanding, all from your own home? If you're interested in this new medical treatment for autism, then click the link below.